right, let's go ahead and get started. Okay, well, we welcome back Dr. Hodges-Crowder, who's here to talk to us a bit more about the nuances in street drugs and teenage behaviors. Dr. Crowder is a Louisiana native of 17 years, with 17 years experience in profit and non-profit behavioral healthcare business management. She was trained as a scientist practitioner in counseling psychology with emphasis in neuropsychology and diagnostic evaluation. She has developed, implemented, and supervised programs in social detoxification, intensive residential addictive disorders treatment, corporate drug-free workplace, and outpatient behavioral healthcare milieu in Florida, Georgia, and Louisiana. She's currently the Residential Services Director for Council of Alcoholism and Drug Abuse in Northwest Louisiana, which you all will, if haven't visited yet, in your adolescent rotation. Thank you for being here, Dr. Crowder.
Appreciate it. Good morning. Glad to be back with you guys this morning. Last time I visited with you, we talked about the movement to integrate screenings for drug and alcohol problems in the pediatric population, and I think it's important in conjunction with that information for you to get some information on what are the kids doing these days, what kind of alcohol and drug issues are we running into with children, not just once they have problems, but prevention efforts too. We know from all the studies over the last 30 years that prevention efforts work best if kids get information from all areas of their life. So they get it at school, they get it at home, they get it from their medical providers, they get it in their social settings, at their clubs, and in their recreational activities. So you guys are actually a very important component of assisting in prevention efforts, not just identification of problems and treatment. So that's what we're going to talk about today. And a little bit more about how to just briefly screen and talk about this stuff with kids. So what we know that's happening in the United States with kids and drug and alcohol abuse has been tracked for many years. National Institute of Health and the National Institute of Drug Abuse, Substance Abuse and Mental Health Administration funds millions of dollars worth of studies. So we actually have point-in-time surveys that are done annually, but there's a big study that's done every 2 years. And what we know is that we do have some decreases in use. However, there are some substances that have come on the scene in the last few years that are very strong right now, and one of our biggest worries locally. Of course, kids, when they are testing limits, and most children report trying alcohol for the first time around age 12, okay, in this region. Remember that we're in Louisiana, and we like to eat and drink and play, and children are introduced to alcohol at an earlier age in this area than some other parts of the country. Unfortunately, a lot of what they view with alcohol is excessive use and with really good times, so they don't always get good modeled behavior. But we do see a decrease in alcohol use over the last 10 years. Part of that is credited with prevention efforts and tightening access to alcohol. Kids can't just go into the store and buy alcohol, and if one attempts to do so, there are consequences for that. And we've also in Louisiana put in place fines for individuals and companies that will sell to minors. We actually have a program, if you're not aware of it, where the state pays kids to go in and try to purchase alcohol and tobacco. So people do get caught doing that. The number one illegal drug that kids are using, experimenting with, is of course marijuana. It is actually, I have kids tell me all the time that it's easier for them to get marijuana than anything else. It's very prevalent in our society. We've got a lot of changes in thinking about marijuana in our country. And so we approach prevention of marijuana use from a perspective with kids in Louisiana that it's still illegal here. So when they engage in this behavior, they're putting their life at risk from the standpoint of being kicked out of school, having to go to jail, and I do see lots of kids go to jail over possession of marijuana. Most of the time they're getting caught at school, and there's an extra charge that comes with having drugs or alcohol within so many feet of school property. So they unfortunately get several charges aside from just a possession charge. Possession of marijuana is actually a misdemeanor charge, but if you have it near a school, it becomes a bigger charge. We are seeing a drastic increase in the use of synthetic cannabis. And it's very frightening. I think there was a story in the news in the last few days. They had 190 admissions to an ER in New York, people overdosing on synthetic marijuana. It's a very scary drug. I see lots of kids that get addicted to it very quickly, and they don't view synthetic the same way that they do regular marijuana. There is some maladaptive thinking that's going on that it's safer because you can buy it over the counter, you have easy access to it, so it's okay to use. It's also cheap and easy to get. We see over-the-counter medications abused on a regular basis. E-cigarettes are a surprising trend in the data that we've seen from 2012 to 2014. There's a dramatic increase in the use of e-cigarettes with adolescents and teenagers. It's viewed as less harmful than other tobacco. And then, of course, we have a lot of misuse of prescription medications. And I believe the statistics shows that 85% of kids that admit to misusing prescription medications report that they get it from a friend or a family member. So they're getting access to these drugs at home, friends' homes, relatives' homes. Synthetic marijuana, street name Spice or K2, is the second most popular illegal drug with young people. And we call it an illegal drug even though you can buy it over the counter because it's not meant for human consumption. And it is illegal to smoke it. However, you can purchase it. It's usually sold as incense, and it is amazing, the manufacturers of these different drugs, how fast they are staying ahead of our research and our laws. Because every time a chemical is identified as hazardous and placed on the scheduling system with the DEA, there's 10 new ones to replace it. So we are constantly battling this. I just ran across the first comprehensive study of the impact of synthetic marijuana on the body because we have such a hard time isolating the chemicals and there's so many different ones. But the primary negative effects that we're seeing with this is a lot of impulse control problems, increased anger, difficulties, outbursts, and kids that normally don't have any of these problems. These are not kids that already had ADHD or unspecified impulse control disorders. They just, there seems to be some dysfunction where this chemical is attacking the frontal lobe and just intense anger. Some of the kids are getting addicted very quickly, and they will just sit and smoke it all day long. Sit and smoke it all day long, to the point where they're overdosing, lots of liver damage, lung damage, irreversible physical problems. We also see with synthetic drugs the use of bath salts. There was a big campaign against bath salts about 4 or 5 years ago, and so the kids that are hitting high school now are not using this to the extent that it was used know, 5 or 6 years ago, but it is still pretty prevalent. This is something you can buy over the counter too. And it's got the same problems that the synthetic marijuana does. These drugs actually act more as a stimulant, more similar to a methamphetamine molecule. And like methamphetamines, very dangerous, especially when they're not made correctly. You know, there's a fine line between pure crystal methamphetamine and something that will instantly kill you. And the individuals that make these drugs aren't the most scrupulous people, and most of them aren't really chemists either. So this is very disturbing drug to find kids using. This is a young lady that overdosed on some bath salts and was in a coma for several weeks. She's awake, but she's functioning. This happened when she was 16 years old, and she's functioning about an 8 or 9-year-old level now. She has some permanent brain damage. Signs and symptoms of mental retardation, you know, and this is as good as it's ever going to get for her. She used it twice. Another synthetic drug that we are seeing a lot of in this area, the kids like to call it Molly. It's MDMA. It's making a big comeback. This was a very popular drug in the 80s. This drug was actually legal when I was in high school. They were in the process of making it illegal. It was all over the place around here in the Dallas area. And it's been illegal since, I think, 1989, but people are getting better at manufacturing it. Molly is pure MDMA, supposedly, but what happens a lot of times is instead of it being that pure molecule, there are additives in there to cut costs, so the drug dealers make more money, and it causes a lot of physical problems when using and then afterwards. It's interesting because it has stimulant and hallucinogenic properties, so everybody's always debating about what drug category we're going to put it in, but it is a Schedule 1 on the DEA schedule.
What is MDMA stand?
It is a big, long chemical name, and I'm sorry, I can't tell you. I can pull it up for you.
I mean, is it related to amphetamines or?
No, it's a completely different chemical. It has some similar properties to a methamphetamine, but also to a hallucinogen.
Well, you were saying India. Do you mean it's related to India or what?
MDMA. So
What makes it? Is this backyard or is it?
this is backyard. There are some companies that manufacture MDMA for medical research, and I don't know how much you guys keep up with up and coming treatment for different post-traumatic stress disorders, chronic major depressions and things, but the DEA actually has this drug as a Schedule 1 drug, which means that it has a high potential for abuse and no accepted medical treatment use, but it is being used in research right now. Most of the research is being done in San Diego with vets to use MDMA for the treatment of PTSD, and it actually shows some success in a controlled environment. So it'll be interesting to see what happens with that. But most of the MDMA that we see around here is not that good, high quality pharmaceutical grade MDMA. This drug, taken without regulation, causes an extreme rise in body temperatures, and we've seen kids with heart attacks as a result of this. It causes severe dehydration, and the euphoria that comes with the drug prevents the person from using it from really tuning in to body cues and understanding that something's happening. So we can see some severe dehydration issues and all the negative long-term impact from that. Unfortunately, the way that the chemical acts in the brain, it increases, all of the feel-good neurotransmitters, and they have a pretty big, huge crash when they're coming off of this drug. So they look very depressed, suicidal at times, paranoid, they can't sleep. They have hand tremors, muscle cramps, teeth clenching problems. And I've literally been in a pediatrician's office before with my kid, with a mom waiting for them to look at her daughter, who was about 15 years old, because she was having these symptoms all day. And she had spent the night out the night before, so I didn't get to see the final outcome of that. But, it does happen, and this might be a situation where an observant parent brings a kid in thinking they've got some kind of stomach virus or something. So these symptoms are always a big cue that something might be going on. Some of the creative things that children do these days, and again, I've seen kids as young as 10 involved in some of these parties. This is real popular in our area. They like to take over-the-counter cold medications or codeine, cough medicine, cough syrups, and put it in some Sprite with some Jolly Ranchers and make it taste real sweet, sugary, and they drink it, they slam it, they shoot it, and they put a lot of pills in there at one time. So we can see overdoses from this. It causes some euphoria, but some disconnection, memory loss, a lot of behavior that's very self-harming and dangerous. They lose their ability to gauge danger in situations, jumping off of buildings, riding on the top of the car while it's moving, that kind of stuff. And this is a really big problem because they have access to all of these components. We also still see some inhalant use. I got a call from the emergency room Monday evening about a kid that had been huffing some hairspray. This was a really big problem 10, 12 years ago. We saw this all the time. You don't see it so often anymore. Generally, children who are extremely impulsive prior to drug use, thrill-seeking, always looking for stimulation, will try things like this when they can't get other drugs. They actually inhale the fumes from gasoline, from lighter fluid. They will inhale the aerosol cans. And it is really scary because this does acute damage immediately. I've seen children who were huffing chemicals that have permanent vision loss, double vision that never goes away. We end up with a lot of intellectual deficiencies. It's as if they lose IQ points, learning disabilities, impulse control problems, lots of memory problems. They're also very moody, more so than what you would expect as normal changes through the developmental period. It's pretty scary. I always advise everybody to keep anything that's aerosol protected in your home just as you do any other prescription or over-the-counter medications, because it might not be your kid, it might be somebody else that comes into your home. But this is very, very scary, and it can cause sudden cardiac arrest and death very quickly. So in addition to the purple fizz, kids around here a lot of times talk about taking triple C's. And that's just the Coricidin cough and cold medicine. We have made a lot of progress in controlling some of these over-the-counter medications better. Several of the over-the-counter medications are kept behind the pharmacy counter now, and you have to show up. You can't buy them unless you're 18 or older, which, by the way, you can't buy a lot of aerosols unless you're 18 or older now, too, in Louisiana. You can still buy hairspray, but any kind of automobile sources, solvents, anything like that, you have to be 18 to buy. So people were using a lot of over-the-counter cold medicines to make methamphetamine, and that's how that got put back. But we still have everyday meds that are over-the-counter that the kids are using. This has got Delsum and Robitussin on it, and it's all over the shelves. Sudafed tablets, the Tylenol cough and cold medications that are used. A lot of pain relievers will have a diphenhydramine added to it now, and they call them sleep meds, you know, and even just Benadryl by itself. They'll take 10 or 12, 15 of them at a time, and it will make you feel high. And of course, all the risks that go along with that are there, especially if they're taking an excessive amount of the allergy medications, because they get to a point where they don't know what they're doing and they can't remember anything. Lots of damage to processing speeds. They think slower, talk slower, comprehension problems, and unfortunately, a lot of times they don't recognize it. So, big problem. Energy drinks. And people always start squirming when I talk about this. Everybody likes their energy drinks. Energy drinks in themselves aren't bad, but kids will slam these, and they'll drink 4 or 5 of them straight in a row. And if you've ever had a little too much coffee or one too many, Red Bulls, you know how that feels. They will do that and take that, drink that with the pills that we just discussed. And so they've just really got a high level of caffeine and sugar, even, overdosing on vitamins can cause a lot of problems. Four Loko is a drink which I think is actually illegal in Louisiana now, but it had enough chemicals in it that it was the equivalent of drinking 4 beers at one time and a cup of coffee. So it's kind of like putting vodka and Red Bull together. You kind of get a wide awake drunk, and kids are real hip to this one. And if you see that we've got, from this last survey in 2012, 35%, at least a third of 8th graders, so that's 13-year-olds, are consuming energy drinks every day. Okay, and 29% of 10th and 12th graders. So this is when I think about this from a routine medical checkup standpoint and from a healthy lifestyles choices standpoint, which it seems to be, a big focus with the American Pediatric Association these days, is to helping kids learn how to make healthy choices. You're encouraging exercise, you're encouraging healthy eating habits. This should be right along in with nutritional talks here, because this behavior develops a habit that these kids are going to struggle with for the rest of their lives. It's no different than if they were, drinking a liter of cola every day. It's not very common in our culture for 13, 14-year-olds to be drinking coffee every morning. see it every now and then, but it's not real common. But I have seen, 14, 15-year-olds with coffee habits. We have to detox them off caffeine when they come in to our treatment programs because they're just drinking caffeine all day long. So they're conditioning their bodies to be dependent on these stimulants all the time. Sometimes they get creative, and if they can't find alcohol, and they get on the internet and start looking around and finding ways to get alcohol other ways, they actually will distill the alcohol out of hand sanitizers. And it's pretty strong and deadly. And I have seen this in Louisiana. So it was funny in the treatment centers over time, everybody was so excited to get hand sanitizers, and then the adults and kids started doing this. We had to get rid of that, and then we got the foam kind, but then all those were in pressurized cans, so can't use those either. So we just use plain old soap and water now again. Double slide, sorry. So when we're talking about kids and drug use, we're talking about the use of legal substances, which is illegal for them. We're talking about misuse of legal drugs, which includes prescription drugs. There is a huge problem with kids sharing, selling their ADHD medications. We have a tremendous number of children diagnosed with ADHD in this country and in this area. And the stimulant medications that are prescribed to help control those symptoms are very effective, but they're also great to get high with if you don't have the disorder. And so we see a lot of trading of drugs related to stimulants, Adderall, and just good old Ritalin. I actually see a lot of adults abusing their children's medications. So this is always a problem, and what we do, of course, if a child has ADHD, learning disabilities, or any kind of mood disorder, they have a higher risk of drug or alcohol use. So a large percentage of the children that we end up with in treatment who have drug and alcohol problems were taking medications to manage these types of symptoms before they come to treatment. And the standard protocol to address that is to remove these stimulant drugs for 30 days and get a baseline and then see if they really need them or not. Because it's kind of hard to tell if a kid really needs medication management of their symptoms if they've been smoking pot every day, or they're drinking energy drinks every day, or they're binge drinking alcohol on a regular basis. You really don't know what their baseline is. So their impulse control problems can be related to their drug use or to this, or it can just be behavioral problems, lack of supervision, whatever it may be. So we try to get a baseline on this. But we see a lot of stimulant abuse, and of course opiates and benzodiazepines, the same as you see in adult populations. And I think that parents, one thing I really like about the standards that are set out for your profession is that there's a lot of encouragement to talk to parents and educate parents about the dangers of these problems, because a lot of times parents have these medications available to treat legitimate illnesses, and they don't realize that they could be providing a means to an end for curious children. So any kind of drug that has a sedative, hypnotic effect is a risk, and of course our narcotics, opiates. Our last survey said that 68% of 12th graders had tried a prescription pain reliever for non-medical use. That's pretty scary. 68%. So by the time kids are, 16, 17 years old, they've had a lot of access to opiates. We're also starting to see some disturbing trends with athletics. Kids that are involved in a lot of sports activities. Sports are very important in our culture here in Louisiana and America in general. A lot of football, basketball, baseball injuries. We have a big soccer and lacrosse population in these areas too. With injuries, we're seeing a trend to hurry up and fix it so they can get back to sporting activities. And so a lot of times kids will they'll get some prescription pain medicine to treat that injury, but they'll continue to take that medication and get it in other ways after the amount of time it was prescribed in order to move forward with the injury and continue the activity. And it is hard to get prescription medications on the street. I guess not necessarily hard, but it's expensive. So if you can't get it from your family members or your friends, you can't trade for it. They can get heroin pretty easily, cheaply. One oxycodone pill, I think, costs $8 or $10 on the streets. You can get a whole bag of heroin for that. So unfortunately, we're seeing a rise as the federal regulations get tighter on the prescribing of opiates and narcotics, as it's harder to get them, as the prices go up on them. More and more people are turning to alternatives, and heroin is the most prevalent. We actually have a pretty big surge in heroin IV use among teenagers in our state right now, and it's a problem because of the way that treatment works. You need a medical detox for heroin use, whether they're using it IV or snorting it, and there are no medical detoxes, no medical detox treatment centers for kids. They're all for adults. So we're running into a problem. I have 3 kids right now out of 12 we're treating for heroin addiction. We have seen a tremendous rise in this over the last 6 months. In New Orleans area, they have the 3rd highest IV heroin use per capita in the United States. So there's a lot of heroin, New Orleans, Baton Rouge area, and it's coming this way. And unfortunately, because of the addictive nature of the drug and the calming and sedative effect of it, it is very easy to use it on a regular basis and not realize how dependent you get on it and how quickly. And this is a very difficult drug to stop using. It is painful, physically painful to stop using any narcotics if you've been using them for an extended period of time. And it's got a significant psychological dependency issue as well, because these guys experience pretty high levels of anxiety during detox and afterwards for up to 6 months. We have an adult detox program at CADA where we use a Suboxone protocol to detox off of opiates, and it's the standard American Medical Association accepted protocol. It's a 5-day detox, and that is not near enough. We have lots of problems with individuals after that. A lot of times our medical director will extend it for 7 days, but these patients end up with what look like acute detox symptoms for 3 to 4 weeks. It's pretty amazing. So right now we're putting the kids in the hospital and detoxing them that way 7 to 10 days, and then taking them into treatment. And kids who are using opiates and narcotics, you can see that drug use's negative impact very quickly with them. It's not going to be a surprise that they're having drug problems when you see them. They look bad, they feel bad, they have lost interest in everything that's going on in their lives. They are having significant interpersonal relationship problems and very poor judgment, worse than what you expect normally from adolescents. So this is the big study that's done every 2 years, and you can see that the number one, this is a nationwide study, number one drug, marijuana, then the synthetic marijuana, and then the different prescription over-the-counter medications. Alcohol is still number one, it's not on this chart. So these are 16, 17-year-olds reporting this. It's a pretty significant number of kids who are using drugs on a regular basis. And part of what we know to be true is that, you know, it's pretty easy to identify the drug problems once they're there, but we can really affect some change for a lot of kids if we can increase our prevention efforts and start addressing what is considered casual drug use early, before it gets to that point. This is just some information about the Monitoring the Future survey that I just showed you. They've been doing that since 1975, so they've got some pretty good information. So what we know about prevention, and this is where, you know, being in clinic or practice in the emergency room, all those places that you guys have to go, this is where all of this information comes in, because they're getting drug education, prevention information at school. Hopefully they're getting it at home, and they're seeing it all over the place. We have a huge national and local campaign for drug use prevention. You see the commercials on TV, I'm sure. But what we know is that kids successfully avoid problems with drugs and alcohol if we're able to increase the protective factors that help keep them from turning to drugs and alcohol for relief, or even increasing the factors so that we can help instill some attitude changes. Because what we know about kids is what they believe and how they feel about something really determines how engaged they're going to get in that behavior. So, and smoking cigarettes is a great example. You know, our country has done a great job of letting all of us know how dangerous smoking tobacco is, and that you know, you're going to get face cancer if you use, you know, chewable tobacco, and you're going to get lung cancer if you smoke. And so we have a whole generation of kids for the first time that have a lower first-time use of cigarettes than at any other time. Our campaign has been very successful. However, now they have to add in the hookah and the e-cigarettes, because we're seeing a rise in that. But giving them the information, affecting the change is a protective factor, and then reducing the risk factors. So when you're dealing with children that have obvious behavior problems from a very young age, a lot of the literature says that you can start enhancing protective factors with children as young as 2. You see a kid who is, you know, attention-seeking, thrill-seeking, has poor mood regulation, poor anger modulation. They are struggling in school, you know, when they're in 1st, 2nd, 3rd grade. That kid's at risk for drug and alcohol use already. They're already experiencing stress and anxiety relative to the demands that life is putting on them. As they grow and move through different developmental stages, the number one way to change the way they feel is going to be through chemical use. So we already know that. So talking with their parents about, you know, drug education, prevention, making sure that they are getting assistance, you know, if they're really struggling in school, well, you know, have you talked to the counselor at school about that? Or there's usually a counselor at school can, you know, check into that, address, if it looks like a kid is really having some emotional difficulties like we discussed last time, you know, make that referral, because all of that is part of prevention. Risk factors are not only from, you know, internal motivators, but also from external motivators. You guys are here in a community where we have a high level of poverty, we have a high level of uninsured individuals, a high level of unemployed individuals, and you know, when you have those community problems, you have a higher rate of drug and alcohol use. So kids are growing up around that. You know, providing information available to kids where they understand that that's not how the whole world works. You know, everybody doesn't smoke pot. Everybody doesn't drink excessively every day. People do go to work. People do have productive lives. Providing opportunities for kids to see different lifestyles and different productive work environments. Projects like, you know, take your kid to work and be a doctor for a day. I don't think y'all do that here, but they do it in other places, where kids have the opportunity to come and actually watch and see what people do as part of career development planning. And they do that in elementary school in some areas. The earlier we can help the kids, the earlier we can address it with the parents, the less likely they're going to be to have lifelong problems. So we're trying to hit it from all life areas. And so when you're talking to kids, I think most of us think about having the drug talk with teens, and like I said, we see regular use in 10-year-olds. So when you're thinking about prevention efforts, start thinking about it from, you know, 9, 10-year-olds, and understanding that it's not just about using substances that are illegal. It's also about using legal drugs. It's about tobacco, alcohol, over-the-counter medications, other people's medicines. It's not okay to take other people's medicines. The dangers of doing that, the use of illegal drugs, even misuse of you know, of Tylenol or Naproxen. All of that information is not something that kids automatically know. We have to provide that to them. So you're always looking at the different ways that chemicals can be misused. As I mentioned a few minutes ago, our primary risk factors in children are poor self-control, aggression, poor social skills. If they're socially isolated, it's a big problem. If you have a kid who's having trouble making friends or fitting in their peer group, that is a primary concern. Any kind of academic difficulties, kids with learning disabilities, impulse control, behavior problems at school are 50% more likely to use drugs and alcohol than kids that don't have those problems. These kids with academic difficulties that go to school every day are constantly in an environment where they feel inadequate, inept, and they don't understand or don't know what's going on. They have a heightened state of stress all the time. You know, I talk to parents and like, you know, he's been smoking pot every day. I don't know why, you know. I do, you know. He's stressed out all the time. You know, he has some relief. You know, he's getting stoned and going to class, so he doesn't have to deal with it. Any kind of family discord, family problems, parents not getting along, lack of parental supervision, modeled behaviors. They're watching their caregivers do it. They're watching their older brothers and sisters. I see a lot of kids learning how to do drugs and alcohol from their older siblings. And the biggest problem with that is that parents are not always paying close enough attention to that. You know, go hang out, you've got a 12-year-old that's hanging out with a 16-year-old. The 12-year-old's going to be doing what 16-year-olds do. That's not necessarily a good thing, okay? Paying attention to those things, making sure that, do children have peers that they engage in recreational activities, or are they hanging out with older kids all the time? Modeled behaviors really, really impact what they choose to do. So as a community, some of the things we're working on and some of the things that we try to work on individually as different types of service providers is to make sure that kids have the support that they need to be successful in the tasks that we're asking them to do. You know, kids go to school every day. That's their job. That's what they're supposed to do. They're expected to excel at it. They're expected to be engaged in it. And, you know, not every kid likes school. So there's a movement to help address education needs from different perspectives. And of course, Louisiana's a little behind the times on that, but there are some support programs in place to help kids who are struggling. If you have a family that comes in, you got a sick kid that comes in and you know, they seem off, they're not quite right, and you've got a mother that is just hovering all around that kid, or constantly telling that kid what they're doing wrong while you're sitting there trying to talk to them, you know, that's a big red flag, and maybe you need to give them one of those referrals we talked about for mental health evaluation. Because both of them could probably benefit from it. You know, having some support somewhere in life is very important. Kids who are confident and believe in themselves are less likely to use drugs and alcohol. Of course, then you have, when you go to the extreme, kids that are overconfident, you know, that are kind of narcissistic and full of themselves. They actually go back up on the list of risks for drug use because they don't think anything's going to happen to them. But strong self-efficacy, believing in yourself, believing that you can be successful, that you can accomplish your goals, is a protective factor from drug and alcohol use. Are these kids assertive? Are they going to be able to decline drugs or alcohol when they're offered? You know, the risk factors for children change as they age. So they have more of a risk of using drugs and alcohol in a peer setting the older they are once they move through into their teenage years. Kids are more likely to use drugs and alcohol with their friends as teenagers. Kids are more likely to use drugs and alcohol with family members younger. So are they able to say no? You know, do they understand the need to say no? It does matter who kids hang out with. It does matter. What are their attitudes about drugs? Any type of drug. This is an interesting challenge right now with marijuana. Regardless of how you feel about whether marijuana should be legal or not, it is illegal in Louisiana. And so kids will have problems if they're smoking marijuana. I have seen people addicted to marijuana. Not everybody that smokes it is addicted. There are people that function smoking marijuana just like there are people that function that drink alcohol. Okay. The problem with children using this drugs is that they're going to run into legal difficulties, and it impacts every aspect of their lives. It prevents them from engaging in activities that give them purpose and give them those experiences where they create a strong self-efficacy. Because if you have a dirty drug screen, you can't participate in sports. You can't be on the debate team, you can't go on that field trip. It hurts all of their social activities. They get involved in the legal system, they have problems, and even though you know, juvenile records are sealed, they can be unsealed. Okay? So if somebody getting arrested for possession charge at 15 can prevent them from, you know, going to the school of their choice when they're 25. You know, so these are unfortunate mistakes that could happen for them that could impact the rest of their lives. You know, and it's awful to make a mistake at 13 that will prevent you from growing up and having the profession that you want to have, you know. So if we can help change their attitudes, and this is all part of the wellness process about drug use, then hopefully we can help prevent the start of it. Lots of leisure time activities. When kids are bored, they look for stuff to do, okay? And that doesn't mean that they're over busy. We've got a lot of kids who are over busy. If they have too much to do, they get stressed and anxious and then they need some relief. So there's got to be a balance in there somewhere. And then having somebody where kids can actually ask the questions. You know, how come it's okay to smoke pot in Colorado, but it's not okay to smoke in Louisiana? You know, that's the valid question. You know, and providing the truth, because kids know when you're not telling the truth. You know, you're not gonna shoot up a bunch of pot and go kill a bunch of people, right? You know, you can't scare them into not using drugs. You have to tell them the truth, and that's what they're looking to you for, is the truth. So allowing them the opportunity to ask those questions and being truthful with them, and that, you know, this is just not good. There's so much brain damage that occurs. It's amazing. We're living in such an exciting time right now with all of our new technology and imaging abilities, and being able to see what's actually happening to the brain with long-term drug use, and how much the introduction of a foreign chemical into a developing brain impacts normal growth and development. It's a tremendous impact. Just with alcohol alone, the ability for children to develop normal filters and communication styles and intellectual abilities can be so negatively impacted, you know, between 15 and 23, 24, while the brain's still developing. Most of these kids that we work with know somebody who's had some sort of problem with drugs or alcohol, whether it's a family member or somebody that lives in the neighborhood or another kid. They know somebody who's overdosed. You know, so they can put their experience on the information that's being provided. So what we ask of medical providers, both with pediatrics and with adults, is that you start to think about the signs and symptoms of these problems and work those into the normal evaluation that you have, and make those referrals, not to be experts on those things or to spend an extra 2 hours counseling somebody, but just giving them referrals for the help. The other thing that's very effective and important is to have the information out for your patients. If they want it, they can take it. If the parents want it, they can take it. And there are lots of sources for free literature, okay? I work in a nonprofit. We are very adept at finding the free literature. And our government spends a lot of money printing brochures about different drugs of abuse, different problems, and how to get help if you need it. So I've got the 3 websites here where you can get that stuff. SAMHSA, Substance Abuse and Mental Health Services Administration, just millions and millions of dollars. And you can go on their website and order 500 brochures at a time, and it doesn't cost you anything, okay? About treatment, about prevention. National Institute of Health has lots of good information, as does the American Academy of Pediatrics. So those are things that, you know, whoever's managing the office activities that can be assigned one of their duties to make sure that those brochures are always ordered and available. Because people will take them and they will read them. And that's just a very simple way for you to add another level of help for your pediatric patients that you're dealing with. Anybody have any questions?